Well, good afternoon, and thank you all for coming. As we continue our community's efforts to reduce the spread of COVID-19, the Columbia-Boone County Public Health and Human Services Director Stephanie Browning issued Order 2020-09 on Friday, August 8th, and it became effective yesterday. Because we continue to see cases rising, both locally and statewide, because our positivity rate remains above 5%, because our rolling 7-day average of new cases reached 34% on August 1st, some minor additional restrictions were placed on businesses open to the public. We remain on Phase 2, Step 3 of our reopening plan, which went into effect June 23rd, and we continue to monitor the data to determine what our next steps will be to protect the health and safety of our community. But as summer fades and we turn towards fall, new challenges await us. The return of thousands of college students and the return to school for thousands of children will require us to be ever vigilant and to be prepared to change directions quickly if needed to ensure our community's health and well-being during this pandemic. I want to invite Stephanie Browning, Director of Columbia and Boone County Health and Human Services, to provide a brief update to date on our efforts and what we might expect in the future. Director Browning?
Moving forward, we will continue to build our capacity. With the support of the Boone County Commission, Public Health and Human Services will receive just under $1.8 million of CARES Act funding to hire additional disease investigators, contact tracers, communicable disease specialists, health educators, data analysts, and data entry staff, plus the equipment needed for all these positions. The Commission has also approved additional funding to ensure that testing for uninsured individuals in our community is available. While Public Health and Human Services and our community partners continue to work together, we need to do more. The most important piece of the puzzle are the residents of this community. Each of us as individuals have the power to protect ourselves and others from this virus by making small choices every day. Social distancing from others, regularly washing our hands, staying home when sick, and wearing a mask when around others are simple yet highly effective tools that we have to fight this virus. Sometimes it's easy to find ourselves slipping back into old habits, but we need to be diligent now more than ever before. More than 55% of cases in Boone County are due to having close contact with someone with COVID. Sometimes we let our guard down, and we go around people that we know and we care about. But that one hug or that one gathering, that could be the time you spread the virus to someone else. It's been a difficult 6 months in this community, and I know it feels like the status of the pandemic changes every day. We are literally watching the scientific process play out in real time. We will continue to make decisions based on science, and that means that the guidance may change. We're asking you to lean in, partner with us as we navigate this next chapter. So now I'd like to invite Dr. Mary Beck, Chief Nursing Officer with MU Healthcare, and one of our partners to share her insight.
Good afternoon, and thank you again. MU Healthcare is very prepared. Our COVID response plan and incident command structure has been in place since early March. We are prepared for continuing care of our community and the students as they return. We want you to be very confident in that. We have protocols in place to keep our patients and staff safe. This includes requiring mask and screening of all who enter our facilities for a temperature and symptoms. We also consistently monitor supplies as well as the capacity of our facilities and our workforce. We review bed and staff availability as well as our PPE, personal protective equipment, blood supplies and ventilators, and many other supplies on a daily basis. MU Healthcare has flexibility to adapt as the needs of our community changes, Whereas the COVID pandemic prevalence rate in our community rises. Specifically, we could adapt by canceling non-emergent procedures, which we did in the spring, further limiting visitors. We had limited totally, we have gone back to a moderate restrictions, further conserving the PPE, personal protective equipment, by limiting the number of students in clinical experiences, and they need that hands-on experience, but we had to do that in the spring also. We can adjust our staffing, adjust space in our facilities to open up additional beds, and establish additional testing sites. Safety is our top priority. Let me say that again, safety is our top priority. As the region's leader in treating infectious diseases, including COVID-19, we have used our expertise to ensure we're providing safe options for in-person care in addition to virtual care options.
The University of Missouri has been planning for months to safely return 30,000 students, not only to campus, but to our community. I'm pleased to welcome Dr. Moon Choi, President and Chancellor of the University of Missouri, to share how the university is prepared. Dr. Choi.
Thank you. Good afternoon. I want to thank Mayor Treese, Director Browning, and also Superintendent Stiepelman for being such great partners to the university as we address this pandemic together. And I've been thinking about what this situation represents for public higher education, and it goes without saying that it's probably the most challenging period that we've faced in 75 years at the end of World War II. But having wonderful partners with the same objective of creating a safe and healthy Columbia-Boone County has been incredibly rewarding. Now, as I begin my remarks, I am really thinking about two things. One is pride, and the other is gratitude. And pride in the ability of our faculty members to quickly pivot and do things that they've not done before to provide a high-quality education for our students. And for our students for being so resilient to weather this storm and continue with their studies. And our records indicate that at Mizzou, we expect to have an enrollment in the fall that is higher than the enrollment we had last year. And I cannot say enough about the pride and gratitude that I have for the first responders that we have in this community. That's reflected in our nurses, doctors, and support staff in all of the hospitals, but especially at MU Healthcare. They've given of themselves to protect our community, and I'm so proud of that. Now, as a university, we have several very important missions, and that includes student success, research and creative works, and engagement. But now I believe we need to add in there health and safety as a very important element that undergirds the foundations of what we do at a university. So for this semester coming up, we created a very effective plan for reintegrating 30,000 students and about 10,000 faculty and staff back on the campus. As part of that effort that we call Show Me Renewal, we are limiting the size of classes that can be held face-to-face. And when we combine the face-to-face to what we call the blended approach, using face-to-face and online, that represents 65% of the classes, and purely online is 35% of the classes going forward. Our laboratories in which our faculty members and students perform the research will be reconfigured so that we can have proper social distancing and the use of face coverings. Now, it's very important for all of us to recognize that we don't live in an island, and that our actions or lack of actions and accountability for following the procedures can have an impact to this community. So we're communicating very effectively through educational programs as well as enforcement programs so that we have individuals who follow the procedures for face coverings, social distancing, hand washing, and so forth. We are also implementing a a very effective app so that our students, faculty, and staff can check their symptoms and provide proof that they checked their symptoms and are ready to come to class or go to work. And all of these efforts are done in a way that we have safe and a healthy university, because the work that we do is so important, not only for education, but the economic vitality of this community. So I look forward to answering your questions, and thank you very much for your support.
Columbia Public Schools has also been partnering with healthcare professionals and the community for months to ensure that our youngest students are able to safely return to the classroom and have ample opportunities for online learning. I welcome Dr. Peter Stiepelman to the podium.
And at that conversation, in this virtual Zoom meeting of the Rotary, they asked me what was different now. Not in terms of all of the vision that we had for where we were going for this coming year, but what was different about June, when the school district released its plan on June 22nd. And we offered two choices to families. We said, we've heard from our community, and 80% of our community wants to be in school full-time, 5 days. And so we offered 5 days full-time or online. And so what is different is that March and April and May and June revealed really promising data for our community in terms of the rate of infection, the rate of cases. When we looked at 5-day averages that you can see on the Boone County website, everything looked so promising for our return. And July was a very different story. And as July continued to march along, we started to see very much increased rates, and it began to worry us. I know it has worried the University of Missouri, which is why, as you just heard, they put together a robust plan in terms of their return. And so we had to pivot as well. And so last night, the Board of Education met, and they authorized the additional tool for the administration so that we could offer full-time 5 days if the data supported it, which currently it does not. They authorized us to institute a hybrid in-person model, which would help us reduce our enrollment by 50% in our classrooms and in our buses, which would allow us to social distance, which is the most important thing that we can be doing. Wear your mask and socially distance. The WHO, the American Association of Pediatrics, both say between 3 and 6 feet. So that's what we had, that was our task. Last Tuesday, the board had a special session of a board meeting, and we were grateful to both Dr. Milham and to Director Browning for being present and for guiding the board on some really pointed questions, which was, can we actually have a 5-day full day if we can socially distance? And the answer was, we don't recommend it. And so the board gave us the authority last night to have a hybrid in-person model, which would at least get us to have children in the schools. And for elementary school classrooms, we're talking between 6 and 13 children in a classroom, which is a wonderful opportunity for teachers to be able to individualize instruction. We know how important in-person school is in terms of making sure that our children, 1 in every 2 who participate in free and reduced lunch, have access to their school. For children who participate or are eligible for special education services, to get those services in school, because for so many, a virtual environment is not ideal for their learning. And so we'll have now 3 options, and we're going to use a model that comes from a state north of here. I've been told to stop referring to the state because we live in Missouri and not Minnesota. So we will be using a model that gives us clear direction and allows us to anchor our decisions in data. So if there are 0 to 9 cases over a 14-day period, looking at the per day rate over per 10,000 people, then we can have full day in person 5 days a week. If in fact we find ourselves between 10 and 49, then that says to us, look, our model has to be a hybrid model. And when we find ourselves over 50, that puts us purely in an online situation in terms of our format. We think this helps our community understand where the district stands. On our website, there will be a daily indicator that one can look at to see what the rate is. And then each 3 weeks, when the city makes their announcement about their reopening plan, we will coordinate our plan with theirs. so that the community can get their information in a one-stop shop at one time to understand what is the city doing, what is the schools doing, because we are all the city. So, I want to say, I guess in closing, is that anyone who thinks that let me put it this way, we want our kids back in school. There's no argument about that. The university would love to have their kids in school and not have to think about what does it look like if things don't go well. So we all have an obligation. I think that's probably the driving force of why the mayor has us here all today in terms of this invitation. We should wear our masks, we should socially distance, we should take care of each other and do our very best until there's a vaccine, that we have to do our very best in terms of social distancing and practicing good practices. So anyway, thank you for the opportunity, Mayor, and I am sure there'll be some questions and I'd be happy to stay and answer.